Assalamu alaikum. Now today I am going to tell you how to do the auscultation of the lung. First you are going to introduce yourself, that my name is my name is Dr. Humasmat, and today I am going to auscultate your lung. If you feel any sort of pain, then please tell me and let me know. Now you are going to auscultate the lungs in such a way that you have to use the diaphragm of the stethoscope, and you have to listen at least one complete respiratory cycle at the each side. You are going to auscultate the apices anteriorly in such a way, like anterior, upper, middle, and the lower lung field anteriorly, and this is how you are going to measure it laterally, auscultate the lungs, and this is how you are going to measure the auscultate the lungs posteriorly. Okay, thank you.